This video is a supplemental presentation of the exploration of an external approach to subretinal drug delivery via robot assistance and B-mode OCT. Our work is motivated by the need for slowing macular degeneration with accurate injections of gene therapies to the subretinal space between the retinal pigment epithelium and the rods and cones. On the left, two alternative approaches to delivering subretinal injections are shown. The first is a traditional intraocular approach from the front of the eye, where the needle needs to pass through retinal layers 1, 2, 3, and 4, which are susceptible to hemorrhage and detachment. The second method is a novel approach, which we are presenting for the first time in this paper, and that is an external approach shown here at E. In this method, the needle only punctures through the choroid and RPE layers, decreasing the probability of trauma. Additionally, this approach is believed to be safer when the needle needs to be quickly retracted, as it has fewer retinal layers to pass through and has a shorter path to be a safe distance from the patient. This paper presents a modular robotic system with a handheld device which can be attached to a serial robot arm. Shown in this slide is the handheld device with B-mode OCT probe for cross-sectional imaging of the retina with a needle the user has fine depth control of with an anti-backlash linear actuator. We're focused on advantages offered only by the serial robot arm, so fine depth control is not used in testing. To improve targeting, the handheld device assembles to a 6-DoF serial robot arm, the Mechademic Mecha 500, with a 6-DoF force torque sensor, the ATI Mini 40. We explore the benefits offered by a traditional force-aware admittance control by applying a variable admittance gain, and then we explore the inclusion of depth awareness from real-time segmentation of B-mode OCT images. We tested Cora with 2 different experimental setups, with 4 of the authors of this paper, one of which is a physician. In the first setup, shown in this video clip here, we asked users to follow a 125 micron grid with and without robotic assistance, and compared the error of the needle path to an ideal trajectory. The figure on the left shows the results of one trial from one user with the needle tip positions plotted from the non-robotic trials in blue and the robotic trials in orange, with the ideal path in the black dotted line. The RMS error across all trials were categorized by path quadrants in the figure on the right, showing a convincing decrease in error when using robotic assistance. In the second experimental evaluation, we assessed the user's ability to contact without puncturing the surface of a mock agar tissue. The users tested 3 conditions, first using the standalone Mode 1 device, and in the second condition using the Mode 1 device assembled to Cora with standard variable admittance. In the third condition, cross-sectional B-mode OCT images were segmented in real time to modulate Cora's variable admittance based on the needle's proximity to the sample surface. This table presents the results of the surface approach experiment with the percent of trials resulting in puncture and the error between needle tip and surface in microns. These results indicate a decrease in surface puncture incidence and error to sample surface when using Cora with a standard variable admittance shown in the middle column, and a further decrease in both when supplementing admittance control with B-mode OCT measurements in the column on the right.